Hi everyone, this is Dr. Ginger here. I have a direct question that I am answering from Orofacial Release Part 1. And that question was, what about a tight jaw and a tight tongue? Does it matter? And as you might suspect, the answer is yes, definitely. A tight tongue matters. But how do you even know if you have a tight tongue? It's easy to feel a tight jaw. For example, if you just take 3 fingers, I'll turn to the side, you should be able to open. I hope I'm still on the camera, right? You should be able to open, it's an odd position, and not have any pain, to not feel tightness. So if you're doing that and you can't even get 3, right? Maybe 2 and it's already tight, or if you feel clicking or popping in this area, if you go to your cheekbone and fall under it, that's called the mandibular notch. If you have point tenderness there, which I have talked about before, and or you have clicking or pain, and or you cannot do the 3-finger test, that's the time to go to typically a PT who does this kind of thing, orofacial temporomandibular joint dysfunction treatment, TMJD. So that's first. If the jaw is tight and you have those things, then if it were me, I would actually reach out to that therapist who specializes. So to that end, I'll set that aside. How do you address that tight jaw issue? Well, first of all, you can go into the mandibular notch here and just put a 1-finger width space and hold it. When you go into that space, get comfortable. I'm like on a kneeling rocking chair right now, so you might want to have a chair with a back. You might even want to be lying down, because you would be amazed at how much dysfunctional breathing happens when you're just trying to sit up. It's incredible. And I see that through imaging in my practice, so I'm not making it up. I can see it on the screen. If you struggle with breathing sitting up, don't worry, most people do, because most people aren't advanced breathers. So lie down, take a rest, put a finger width between the teeth. This is what I would typically suggest for people. Of course, I can't prescribe it for you and it can't be physical therapy, but you can test it, you can try it and just see how it feels, because you can always go out and find an orofacial PT. Now, some of them may not call themselves that. Maybe they'll just start with like TMJ and they only treat that. But hey, that'll get you a long way, okay? Even if they just treat the jaw, which most PTs do, that specialize in that. So you can just work on a deep belly breath, releasing that area. A good PT who specializes in this will also teach you intraoral techniques, so you can get in there and kind of release it on your own. That's another one. If you want to feel it on your own, you actually take the opposite hand, just like I have you do opposite stuff in Orofacial Part 1, and I can't talk while I'm doing it, but you go in against the upper side of the teeth and just see where I am, similar to that area. What does that feel like when you go into that area there, internally, like right up beside the upper teeth? You can do it on both sides. Just seeing what that feels like can be really important. And sometimes just the light point pressure can really transform things for you. So that's a tight jaw. Now, that is not the only fix. It's just a single little tiny drop in the oceanic bucket of tools that I would use to help with that. But see how that feels. Second, tight tongue. How do you know? Well, your articulation, how clearly someone can understand you, how clearly you're speaking, will be impaired. So if you have a tight tongue, things might sound like peanut butter in the mouth. People might say, I can't understand you. You may not be able to articulate that well without creating more tension. You might also notice periodontal pain, actually teeth ligament pain. What will that feel like? Sometimes it's just a matter of you can take one arm, stretch it out behind you like this, or up over your head. And then if you're in a downward facing dog position, like in yoga, like if I stood up, can't do it now, I don't have the space, but if I fold in half on the ground, right, and do a downward facing dog, and I hold this arm out and stretch, and I hold this leg out and stretch. See how I'm stretching them away from each other? Sometimes that tethers the fascial line enough to where you can actually feel internal mouth tightness. That is something to test out and try. If you do feel it, put it in the comments. I want to hear how many of you try that downward facing dog. I call it a three-legged dog, where you won't just put the leg up behind you in a three-legged dog. You will actually do your downward facing dog, and your arms are already out here, right, like this. And then you will take that other leg in your downward facing dog and reach it out to the side and just stretch it as far away from you as you can from the opposite hand. And again, the feeling is that you'll have, some people feel like it's a toothache. So if you have it, put it in the comments, because that gives us some direction to go and some experimentation, because it's all connected. The voice is connected to the pelvic floor. So if you are having tight tongue and tight jaw issues, don't let someone tell you that the pelvic floor or the core will not be impacted. They absolutely can. Now, you may be one of the lucky ones who get away with not having it impacted, but if you've been having chronic issues and you're not finding help, could very well be why. I almost said this is why, because I'm pretty confident that it usually is. But of course, I can't say that without having that, patient-provider relationship with you, because everything that I do is an individual prescription. There are no recipes or cookbooks here. So I hope that helps with the tight tongue and the tight jaw. One of the other things you can do, I'll just put in as a last minute thing here, is if you'll see the trachea here, and see how, if I push my tongue down, it's like a frog, right? It's a little frog movement. I want you to notice what happens. Do you see how it pushes my fingers apart, but it also lowers them at the same time? You should be able to do that, repeatedly, and it not increase symptoms. You should not see the muscles just standing out like this, right? At rest, like that. You might see where they connect, but you should not see them standing out like this. You should not also have increased tension or pain when you do the little frog exercise. So if you do, again, put it in the comments. I want to hear from you. Let's see what happens when you try this out, and hopefully that will get you a little closer to not having a tight tongue and not having a tight jaw. If you like this video, don't forget to subscribe, share it with your friends. I love comments. I personally answer every one. And if you've been struggling with orofacial voice to pelvic floor connection for a while, which means you could have hip pain, back pain, SI joint pain, maybe you're a singer or a dancer, and that transition between singing and dance is just not happening very fluidly, it's a 3 diaphragm problem. So you can reach out at garnerpelvichealth.com. I can't see everyone, but I do a limited number of free consults, yes, free, to help you determine whether or not I can really help you. And I'll try to point you in the right direction. If I cannot, if I can, I do take out-of-state, out-of-country patients that do travel to my clinic here in Greensboro, North Carolina. Hope this helps, and until next time, be well.